Thank you very much. I'm going to start with the latest COVID-19 numbers. As of yesterday in Massachusetts, 262 new cases, bringing the total of cases of coronavirus in Massachusetts to 115,310 confirmed cases. There were 12 deaths yesterday, bringing the total death number in Massachusetts to 8,657. Boston's numbers as well as of yesterday, I don't have today's numbers yet, but yesterday's numbers, 31 new cases for a total case in Boston, 15,018 cases. We had no deaths yesterday, thank God. It's 2 days, consistent days now, without any deaths. Our death total in Boston is 746. And our thoughts and prayers are out to the people and families of suffering from COVID-19 and all the families that lost loved ones. You're in our thoughts and prayers. Trends, we're in this place now. We're giving you the trends at the end of the week. For the week ending August 15th, our 7-day average positive test rate in the city of Boston is 2.8%. That number continues to fluctuate up and down within a 2 to 2.9% range. We haven't got to 3 yet. If you notice, over the last 5 weeks, we've gone as low as 1.9, as high as 2.8, and last week we're at 2.6. As a reminder, that's not the percentage of population infected, it's the tests that are positive. So we're taking an average, roughly about 1,600 tests per day, and that's the average of those tests that we take every day. So it's a very small portion of our population. For daily new cases, we remain in the state's yellow category with just a little over 6 daily cases per 100,000 population. So if you're following the state, they have 3 areas. I believe it's green, yellow, and red, and we're in that yellow category. The number of people in the emergency rooms with COVID symptoms and COVID patients in ICU both remain flat and well below levels of concerns for us right now. So that we don't have currently a cause for alarm, but we certainly are monitoring all the numbers closely on a daily basis. As I said the other day when we were here last, I think it was Tuesday, this certainly is not a time for complacency. Everyone has to keep doing their part to keep us going in the right direction here in Boston and in Massachusetts. We're asking people to continually wash your hands with soap and warm water as often as possible. We're asking you to avoid large crowds. We're asking you to stay 6 feet away from other people. If you're going for a walk, or you're walking, or you're sitting on the beach, or wherever you are, we still keep that physical social distance, if you will, away from other people. We're asking people to continually wear a mask. The important part is wearing a mask. As I look at this press conference, people at home can't see it, but almost everyone around me has a mask on, and that's really important. And we're also asking you to wash down sites that are often touched, whether it's doorknobs or handles on cars, things like that, in your workspaces. If you're in work, constantly wash your workspaces down. In the city of Boston, we're going to continue to be proactive in our efforts to continue to contain this virus with testing, with outreach, with all the resources that we have, and with the information in many different languages and formats that are needed to educate and keep people informed. We're testing over 1,600 people per day on an average, with an increase in almost every neighborhood again last week. Citywide, we have more than 20 different test sites set up throughout the city, including mobile sites that are moving from area to area of the greatest need. In many of these sites, the testing is available at no cost to you who wants to get tested. We launched a free mobile site yesterday at Jubilee Christian Church in Mattapan. It will run today and tomorrow and next week from Tuesday through Saturday. It's free and open to anyone who wants to get tested, regardless of symptoms, and Jubilee has a beautiful big parking lot there, so you can feel safe when you go there. And if you're looking for a full list of testing sites in the city of Boston or something that might be near you, you can go to boston.gov/coronavirus. That's boston.gov/coronavirus. This is also, as we all know, an economic crisis that continues to hurt thousands of workers, families, seniors, and small businesses throughout the city, throughout the state, and throughout the country. We've been working to keep up and to make sure that the city can help us meet the needs of the most vulnerable residents. We're going to continue to do that, and we have to do that to help people keep people safe and healthy. We have to give seniors the ability to stay home as much as possible, and we have to give working people the ability to quarantine when they have symptoms. That's a big part of containing this virus. The Boston Resiliency Fund has been indispensable in this work. It's provided over $25 million in grants to nonprofits and community organizations who are supporting vulnerable residents all throughout the city. In the last week, we've put out over $1.2 million. These organizations have pivoted during COVID to be a lifeline for families and seniors they serve. Many of our nonprofits have a different mission, but they've been able to turn to make sure they provide services, vital services to people. Just a few examples of this I want to give to you today. Fresh Food Generation and the Food Project are working in East Boston to provide families with fresh vegetables, fruits, and dry goods and meals. The need for food and the need for distribution of food is still very high here in Boston. The Talented and Gifted Association Latino program is working with Boston Public School students and their families. They're buying gift cards for 75 low-income families that can be used to support local businesses. So what we're doing is they're getting gift cards, and these families in turn are shopping in their local business districts. So the money that's been raised from the Resiliency Fund is going right back into our economy to help families and, quite honestly, help the businesses in those neighborhoods. Greater Love Community Cares is a group that supports residents who are unemployed or underemployed with rent and other needs. We're hearing more and more every day the needs for supports around rent and utilities and other payments. They're hiring drivers to deliver medicine and essentials to seniors who are medically vulnerable in the neighborhoods of Dorchester, Hyde Park, Jamaica Plain, Mattapan, Mission Hill, and Rosendale. And I'd also ask you to check on your neighbors, because sometimes it's important. Sometimes we have senior citizens that quite honestly shouldn't be out in public because they're vulnerable to the COVID-19 because of underlying health conditions. If we can help them with other ways of helping people, it'll be helping people pick up groceries, pick up medical supplies, picking up medicine, anything that you can do to help them. The members of the South Boston Association of Nonprofit are bringing fresh food, grocery store, gift cards, and meals to low-income families and seniors. I want to just honestly thank all the associations and organizations who have been doing this incredible work for the last 5 months. Not complaining, not saying anything disparaging, just trying to do the right thing to help vulnerable populations. Thank you for your work. And we remain all dedicated to this work. When it comes to Boston Public Schools, families have faced difficult challenges this year, balancing COVID precautions, work, childcare, and the needs for children to learn and to be active. It's been a really tough time, and it's been a tough time since early March, when we had to make the decision to shut school down, literally over a course of a couple of days. I want to thank all of the people for the work that you've done from March through today, and I want to thank the parents for your patience as we continue to move forward here and laying out a plan for what's next. I want to thank our teachers for the incredible work that they do every day on the online learning and preparing for what this school year will look like. I want to thank the Boston Public Schools staff for their commitment to our students and to everyone's commitment to our students in these very difficult and trying times. Starting school is not an easy decision. It's a very complex decision. We have taken the time to follow and look at the science, listen to our public health experts, and constantly monitoring the data as we move forward in making decisions. Our priority has always been and will continue to always be the health and safety of our residents, and our residents, which include our students, our staff, our teachers, everybody. We've taken the time to understand what it will take to open the school building safely for children, for families, for teachers, for all of the other staff that goes into our school in the community. We've taken the time to be in dialogue with families and teachers about their needs and their concerns. Many of our teachers and our staff have real concerns, and we need to continue to listen to those concerns. I want to thank our school leaders as well for the work that they're doing since March of this year, I should say, and the work that they've done continually throughout the summer. This is not a decision where there's a consensus. This week, the Boston Public Schools have begun asking parents and guardians whether they want their children to begin in school, in a hybrid model, or remotely. So far, we've had about 8,000 responses, representing about 15% of the district. Whichever group of parents you look at, the results are clearly divided. We have families who want kids to go back in school. We have families that feel that kids shouldn't go back in school. They're not comfortable in sending their kids to school yet. We are being responsive to all of the concerns that our families and our children have. We are making the in-school component of hybrid learning an optional step for all families. I want to thank, before I get into the plan, I want to thank a few people that are here with me today, and because their guidance and input. And we're not complete. This is an ongoing process. I want to begin by thanking City Councilor Nisa Sabi George, former teacher. I don't think you're never a former teacher. You're always a teacher, a Boston City Councilor, who's been working with us every step of the way on understanding the complexity of this and how we move forward. Chairwoman Alex Oliver Devia from the Boston School Committee. I want to thank Alex and the school committee for their incredible input here. I want to thank Jessica Tang from the President of the Boston Teachers Union as well, who's been advocating on behalf of our kids, her teachers, the entire school community. And we're going to hear from her in a few minutes, the superintendent of the Boston Public Schools, Brenda Casilius. We are working, all of us collectively, to keeping equity at the forefront. We need to and have a balance that we have safety around COVID with the duty we have to educate a student population with high needs. Those needs include closing the opportunity gaps that hurt our Black and Latino students the most. Those needs include disabilities and language supports, many of which can only be met in person. Those needs include safety around trauma, mental health, and family disengagement. For many of our students, school is their safety. To balance these needs, I'm announcing that we're moving forward with a responsible, phased-in plan to start the school year. This approach will give us time to assess health data before every single step with the Boston Public Health Commission. It will allow us to address learning needs and opportunity gaps in person and providing extra help for students learning online. In every step, families have a choice whether to opt into a hybrid learning system or stay fully remote. To be clear, the dates I'm about to mention are dependent on public health data. Each step will begin no sooner than the date listed. On September 21st, 1 month from today, all students will begin with remote learning. On October 1st, the option of hybrid learning may begin for students with the highest needs. On October 15th, optional hybrid learning may begin for the youngest students in all 3 grades of our kindergarten, K0, K1, K2. On October 22nd, an opt-in hybrid learning may begin for grades 1 to 3. On November 5th, an opt-in hybrid learning may begin for grades 4 through 8. That will include grades 6 to 8 in the high schools that have grades 6 or 7 through 12 in those particular schools. On November 16th, an opt-in hybrid learning may begin for grades 9 through 12. If you see the graphics over to my right, notice that your child's first day in the school for hybrid learning will depend on which group they are placed in, A or B. Schools will have unique circumstances that require somewhat different approaches to each phase. This is a very flexible model. School facilities will be in full compliance with state public health guidelines from the first day anyone enters the building, whether it's staff or students. That work is happening now and continues to happen now. It will be complete and ongoing as teachers and school leaders help us identify additional steps. In addition, the phased approach will allow teachers and staff to get comfortable with the safety of the building before any student shows up in the classroom. Teachers will begin their professional development on Tuesday, September 8th for teaching both the remote and hybrid models as we move forward here. The first student will not return into our classroom until October 1st. As more students phase in, it will still be less than 50% of all normal numbers in any school at any given day. Why we need this plan? We feel this is the best approach to educate our children. It creates a staggered approach for students to return to the classroom in a safe and careful way. It's the best way to tackle the opportunity and achievement gaps in our city. We're going to continue to make remote learning as high quality as possible. I have a lot of faith, and I have much faith in our teachers and our leaders to do that. And we're going to support them, and I'm going to support them. And I call on all of our elected officials to support our school leaders and our teachers. But every day outside the classroom is a lost opportunity for many students. Schools mean more than learning. They mean essential services, caring and mentoring, and social development. The other benefits is flexibility. We can adapt to this plan around the health circumstances. We have more options moving forward as we think about it. The bottom line is we need to contain this virus and keep our community safe. If we want to have in-school learning this year, that is one of the most important things we can do. Containing this virus, wearing masks, washing your hands, physical social distancing. All of that is still very important for all of us to do. Young people and kids need to get back to school, in many cases for reasons of equity and safety. And we need to provide quality education in whatever format is required in. That's what this plan makes possible. Every step along the way, we're going to continue to listen to the people that work in the building. We're going to continue to follow the science and the public health data that we've been following for the last 5 months here. Every family will have the choice about when to send their kid to school. If you're a parent and you're not comfortable with sending your child to school, you don't have to send your child to school. If you're a parent and you're looking for some concrete understanding of when school will begin, that's what this plan does. We will continue the work that we began before COVID-19 even happened, closing the opportunity and achievement gaps, giving every single child the quality education that they deserve. The one thing I think I can say safely about all of us here, sometimes we might have different ways of getting to a goal, but we all believe in this. We all believe in making Boston Public Schools the greatest urban district in the country. This has been a positive, collaborative process. I'm grateful to the superintendent, the school leaders who we spoke to this morning, the teachers, all of the staff at our schools have been working hard and working together to come up not just with this plan, but preparing what school will look like in September. I'm grateful to the families and the students for their patience and their contributions. I know this is a stressful time. It's a stressful time for all of us. I'm going to ask the superintendent now to come up and say a few more, and then I have a couple more updates, and then I'm going to open up for questions. Superintendent.
Thank you, Mayor, and thank you to everyone here today. When we were here a few weeks ago, I showed some love to my City of Boston colleagues, and I want to again recognize all the hard work of this dedicated team. I especially want to thank my colleague, Chief Martinez, for his incredible steadfast leadership in this crisis and also his unwavering support for me as we've struggled with this very difficult decision before us. I'd also like to recognize and thank President Tang and all of our teachers for their incredible feedback over these past several months, and all of our union partners in the Boston Public Schools. I also want to thank our incredible team at Boston Public Schools for working so hard over the summer, putting in many, many hours. This includes my immediate leadership team, but also our school leaders, our basis and managerial staff, and all of our BPS employees. This has been a summer like no other. No other because we are reinventing public education and working towards a responsible and safe and successful start to the school year amid so much uncertainty. We are also navigating uncharted waters and trying to make the best and safest decision for our community. We've taken the needed time to be thorough, thoughtful, and to listen clearly to our students, our families, and our teachers. We've balanced all that feedback with the science and advice and the guidance of our health professionals and state officials. But we're moving forward because we know that the best place for a child is in the classroom with their teacher. Their child development is precious. Our kids don't get a rewind. They only get one childhood, and the time for that opportunity and an equitable, excellent education is now. It won't wait. I often say it's the adults who create the conditions in which children succeed. It is on all of us to figure this out, and we've put in hundreds of hours getting ready, reading the latest research, collaborating, and learning from our local and national colleagues. And we've learned a lot. We put in the hard work so we could be ready and also nimble for the uncertainty we know will be certain to emerge. Throughout all of our decision-making, we've kept equity at the center, and we continue to listen to and respect our parents' voice. I am a mother of 3, and my 2 youngest are in college, and I understand deeply that this is a scary time. We're all a little bit anxious, and there are no perfect answers right now. And we know that some of us have been impacted and hurt more directly by this pandemic, and we are prepared to meet our families where they are and to provide the help that they need. I want to reiterate, and I want to be very clear, that any BPS family can opt in or opt out of the hybrid model. All students have the option to learn remotely 5 days a week. But we also know that some of our students are more vulnerable than others, and some of our students need in-person instruction more than others. I heard that loud and clear throughout all of my listening sessions. One thing that doesn't differ is every parent's worry and desire that their child gets everything that they need and that they are supported as a family. We are evaluating our plans through an equity lens, through an anti-racist lens, looking at how every decision affects our economically disadvantaged students, our homeless students and foster care students, our students of color and English language learners, and our students with special disabilities. We recently completed a racial equity analysis for our reopening planning. We had input from central office leaders, from school leaders, from educators, from advocates, and labor partners on the key equity considerations for a successful reopening. The analysis supports BPS beginning the school year with remote model, and as soon as safely possible, initiating a rolling start hybrid model to address the needs of our medically fragile students, our students with high needs, and our students with disabilities. The analysis also suggests that we prioritize students who require in-person instruction according to parent request, then prioritize other high-need students in a phased-in approach, contingent upon public health guidance, and transportation, staffing, and facility readiness. We recognize that prioritizing the social, emotional, and physical well-being of our students, family, and staff is necessary to addressing equity and also ensuring our overall health and safety. Over the last several months, we have witnessed the inequities that already persisted in our community become exacerbated by the COVID-19 pandemic. In addition, across the country and around the globe, a cultural reckoning has demanded that all of us, including educators, address the racial injustice that has permeated every corner of our society, including public education. We know that in some areas, achievement gaps have widened, but we are also mitigating learning loss. We are also accelerating equitable recovery and returning with the spirit of Boston Strong. Throughout the fall, virtually and in person, we will continue working to build communities that are safe, that are healthy and welcoming, joyful, anti-racist, and culturally linguistically sustaining. We'll continue our district and school-based equity roundtables, and we'll ensure two-way multilingual family communication opportunities are in place and that we're able to provide timely translations to our families. As I mentioned, we're also reinventing public education, and we've learned a lot from our remote learning in the spring. We are building a more robust, clear infrastructure for more equitable recovery in remote teaching and learning at the district level and at the school level. This will be school, not emergency remote learning, with a regular school day, with appropriate services for English language learners, appropriate services for our students with disabilities and our learners with and our English language learners. IEPs will be implemented and accommodations will be put in place, as well as 504 plans. Special education staff will know how to implement those accommodations in both the remote and the in-person learning environments. The City of Boston has committed to providing 2,500 families with home broadband through their Digital Equity Fund. Families can continue to read Comcast Internet Essentials through December, and after that at a reduced rate. We have a joint tech task force with the BTU to help steer the adoption of new tools and to make sure that we are bringing teacher and school leader voice into any new tech adoptions, including hybrid technology. Each school will have a tech coordinator stipend, which will help assist with the coordination of new devices and home internet in every building. And every student will have a tech checkup prior to school start and will log on before school is started for a test. As I said, we've learned a lot from this spring in remote learning. We've heard from our families who have asked for more support using our remote learning platforms. We've heard from educators who have asked for help in setting expectations and better engaging with their students during remote instruction and focusing on their social and emotional well-being. We've heard from students who have asked for more support in their learning and for more personalization and for small group sessions with their peers for connectedness and a sense of community. We'll make sure we are providing all of those opportunities for all our stakeholders, our families, our teachers, our school-based staff, our partners, and our students to learn and to grow and to be supported in remote learning. We also know that out-of-school time is a challenging time for our parents on the other 3 days they're not in school. So we have an innovative partnership with Boston After School Beyond and all of our many partners that we are exploring right now in order to expand off their wonderful summer program and provide other opportunities for families and children in their out-of-school day. Today, though, we are announcing that all students will initially begin the school year learning remotely 5 days a week. We are committed to respecting family choice throughout the fall, as the mayor mentioned. On Wednesday evening, BPS families received an email with a link to a form with questions about their preferences for the fall. Families who have not completed the form will receive another email later today. The form asks families if they prefer that their child learn remotely at home every day of the week or if they prefer a hybrid model. In the hybrid model, students will learn at home 3 days a week and attend in person 2 days a week. For families that prefer the hybrid model, the form also asks if they intend to use yellow bus transportation for 2 days a week, and that students, so that they can attend in person. On Monday, August 24th, BPS will begin making calls to families who have not yet completed or have not yet received the form to assist them in making their selections in their home language. We have bilingual and multilingual staff members supporting this effort. During that process, we will get correct email information for those families to ensure they receive future district communications in their home language. We'll also email all families to confirm their selections and will later provide a school schedule and yellow bus transportation information as applicable. I also want to be cautious and mindful that we understand, as the last several months have demonstrated, that things can and do change. Families will have the opportunity to change their learning model and their transportation preferences that they have selected, and more information about that will be forthcoming. We will be in touch with families throughout the next few weeks to follow up and confirm with details about their selections. And for more information about the learning models or our reopening plan, please visit bostonpublicschools.org/reopening. For questions families For questions, families can also email us at reopening@bostonpublicschools.org. We appreciate your support in helping us with this information and getting this information out to our families. And finally, like the mayor reminded us all, in order to see these plans through and to get our children safely back at school with their teachers who love them, we all must more than ever adhere to the health guidance by wearing our masks, staying 6 feet away from one another, avoiding crowds, washing our hands frequently, and staying home if you're not feeling well. This is the absolute best way to ensure our children can return safely. It's going to take all of us. Thank you for helping us get our children back to school safely.
Thank you very much, Superintendent. Thank you for all your great work here. I also just want to give a shout out. I didn't specifically talk about them, but the bus drivers who continually delivered food for us when the school year went remote in March, the lunch monitors, the cafeteria workers, the paras, the custodians, all of those folks. The custodians have been in the buildings since the very beginning of COVID-19, and they continue to be in the building, getting our buildings ready. And I hope I didn't miss anyone. I might have, and I apologize, but I want to make sure those other workforces that support our district are mentioned as well. So thank you for that. Before I take any questions, just a quick reminder, the deadline to register to vote for the September 1st primary election is tomorrow. So anyone who wants to vote in the primary, September 1st primary, you have to register to vote by tomorrow. You can check your voting status by going to boston.gov/elections. There are several ways to vote this year. Early voting. You can mail in your voting ballot. You can drop them off at a drop box. We have one here at City Hall. At the early vote locations, you can bring your ballot there as well. They're listed if you go to boston.gov/elections. In-person voting on Election Day is still the case. We're going to make sure that those spaces are clean. We did have to change, I believe, 20 locations around the city of Boston. Some of our locations were in senior buildings, elderly buildings, so they didn't feel comfortable having voting in there this year. So again, if your voting location was changed, you would have received a letter in the mail. And also, but you can go to boston.gov/elections to find out where your locations are. To learn more, boston.gov, or call 311 with any questions you have around voting. With that, I'll open up for questions. Yeah.
What would you say to those folks out there who full remote learning is causing social and emotional damage to children? What would you say to those?
The question is, what would I say to people that say full remote learning is causing social, emotional damage to children? I think where we are right now is causing emotional damage to a lot of us, and I think it's very difficult. And I think that starting the school year September 21st, it's going to be remote. Our teachers will reach out to the students beforehand and engage the students just like they would. Unfortunately, it's not in person. I think it's really important for all of us to make sure, parents and guardians, to make sure that all of our kids are in front of that computer on September 21st, because the foundation is going to be laid for that school year. This has been a difficult time, not just for our kids. It's been difficult. I mean, our kids can't play sports. Our kids can't go to school. It's been a very difficult time for a lot of us. So I just think we have to continue to be creative, and I know that the district and the teachers are going to be as creative as possible to keep the young people engaged. The question is, do I feel like we couldn't win the decision? It's not a question of winning and losses. It's a question of the times that we're living in, and making sure that we do the best we can. I mean, this process that we laid out today, that's our intention and that's our hope. We have no idea where we will be with COVID-19 in 4 weeks. We don't know idea if we'll be, hopefully under 1%, or if we're at 4%, we won't be in school. So I don't think I said that, so I just broke news. So that's our threshold. We're looking at 4%. The CDC threshold is 5%. In Boston, our threshold is 4%. We want to make sure that our kids are safe. So it's just the times we're living in.
Communities where many of the BPS students come from, East Boston, Dorchester, Roxbury, the numbers are already above 4%. Is the city going to factor that as we move forward, the rates in those neighborhoods?
Great question. The question is, in the communities of East Boston, Dorchester, and Mattapan, I don't know if you said Mattapan, but I'm going to throw it in there, they're above 4%. I don't believe Dorchester, Mattapan, and Roxbury are above. I think they're at 3 point something right now, but I'll have Marty come up here and address that in a second. East Boston's at 7%. So that's something that we've had many conversations about. How do we handle a situation where a particular neighborhood on one of these start dates will be over that 4% threshold? Don't have a full answer for you right now, but what we are doing is we're making very cognizant decisions right now in East Boston to address the 7%, 7.9 I believe it was last week, to get that number down. I'm going to ask Marty Martinez to come up and talk a little more about the health stuff.
Sure. So thanks, Mayor. Yeah, absolutely. I mean, East Boston, as you know, has been the community that has had the biggest impact across the city, and has been over this threshold for a duration of time. So we're doubling down our efforts. We just had a call with about 100 community leaders this morning, focused specifically on East Boston, some of the work that we're doing. But overall, the rates in the city have been below this 4%. Almost all of our neighborhoods have been over the past 2 months under 4.0%, which is the threshold that the mayor mentioned. But to his point, we're looking at the numbers, multiple factors, multiple times a week, and if we start to see any indication where we see the numbers on average go higher, that's when we will recommend to BPS to sort of pull back some of its plans it has in place. But there's no question we have to be intentional with the neighborhood focus that we're working on right now.
Commission recommends the city to also increase restrictions on businesses if those numbers go up.
Yeah, so what I would give to the mayor is that we make recommendations constantly, the Boston Public Health Commission and Health and Human Services, on how do we look at our increase in our rates, right? So for a while, we were as low as 1.8%, 1.7%, pretty low. As we've upticked just a little bit, we've made recommendations on how do we think about the work we're doing, how do we look at restrictions related to businesses, related to activities and gatherings, et cetera. And again, we've made most of these decisions have really been based on what's the data say, what's the science say, and we'll make those recommendations to the mayor.
And just to that point, most of our decisions have been citywide, so we really haven't had that conversation yet about East Boston. At some point, do we recommend restaurant shutdown, things like that? We haven't gone there, but we're watching all that very closely to see how we move forward here in the city.
For the 4% threshold, if that's exceeded, is that what it's going to take to extend phase one?
Yeah. So what'll happen is you see the phases. So let's just hypothetically say by September, the week of ending September 30th, we're looking at, and we know that it's heading to 4%. Phase one will be pushed down. We won't bring our kids into school. If we're at 4% citywide, we'll not bring our kids into school.
Was there a single tipping point where he said, okay, we have to start all remote now?
No, there was no. The question is, was there a single tipping point that we start all remote now? No, there was no tipping point. I just think that, you know, I've said this many times, nobody in the history of Boston or this country has had to deal with starting school in a pandemic. Maybe 1917, 18, but we've never had to deal with something like this. So everything that we're doing now, we're literally we're learning as we take a day at a time here. And I think for the families, for the students, for the teachers, for all the staff, it's really important for us to think about opening remotely and building up to having more people in school. I think that, you know, at the end of the day, we'll never have 100% of our kids while COVID in this current environment in our schools right now. So we'll have 50% or less in every school. So it really is about building up towards getting our kids in school and learning from the cohort that goes in before them.
4%, just so if it's higher than 4% in East Boston, the rest of the city can stay.
No, we haven't made the decision. It's 4% right now. The threshold's 4% citywide. We have not carved out any neighborhood that might be over 4%.
One neighborhood over 4%, the whole city stays remote.
No, it's at 4% average, 4% across the board. So 4% in testing. And what we're going to do is look at those neighborhoods that might be 4% and see where they're 4%, why they're 4%, dissect the data, make decisions on what we're doing. Was there a cluster in that neighborhood? Is there something that we can see? So, you know, it's not 4% in every neighborhood. So East stays at 4%. The rest of the city's under 4%. We don't start on October 1st. That's not the case. 4%, anything over 4%, won't be starting school. And that's our testing, the testing on a daily basis on a weekly average.
Is it possible that you go to neighborhoods
Yeah, everything's on the table. Obviously, as Marty just mentioned, Marty Martinez, Chief of Health and Human Services, he's looking at these Boston numbers. The teachers, Jessica has brought it to my attention, Anissa, the City Council has brought it to my attention. So we're monitoring that situation very closely. Testing as far as, no, let me have, want to try and address that?
Yeah, so we've been working with BPS to create access to testing. Recently, also, the state released guidance related to a mobile testing unit that will be accessible for public schools to be able to request to come into a school and test if there's cases or any kind of cluster that will be seen. But we've also been working through BPS and with the Boston Public Health Commission several options to create access to testing, partnerships between neighborhood schools with local community health centers, who, if everyone knows, done an amazing job bringing up testing. We've also been partnering with bringing a city-based mobile testing unit to a school to be able to test folks as needed and as necessary to ensure that's the case, but also to encourage folks to still get access to testing the way it's available today. In the city, we have access to do about 2,600 tests a day, every single day in the city of Boston. So we have a lot of capacity for families today and are encouraging folks to do that. So we're working with BPS to make sure people know where to get access to testing, not only for students, but for teachers as well. Yeah, so testing will happen if necessary. So if someone shows up symptomatic, a protocol's been laid out with school nurses to be able to understand if someone's symptomatic, how do you isolate that student in an isolation room in a school, and then talk to their parents to figure out if they want to get access immediately or take them to their doctor, whatever's the case, to get tested. And then if we find out there's cases there in that way, we then will work methodically through schools. It's sort of the same effort that we've been doing across the board: test, trace, isolate to contain COVID. It's the same plan for the Boston Public Schools.
How do your members feel about this plan, hybrid, that sort of thing?
So we will have a statement later and happy to share more details in response to that. But we are all committed to figuring out how to put health and safety at the center of all the decisions and make sure that all of our details are being really considered so that we can have the safest plan possible.
Members have any concerns about this? Can you talk about that at all, or do you think it's a good way to go?
Sure. I mean, again, I think there's a lot of concerns from all parties, whether it be parents, students, teachers, etc. And so again, we're working with the district and the city to determine the best plan possible and the safest way possible. And this is certainly a step in the right direction. And so we still have a lot of details to work out and a lot of questions that need to be answered, etc. But we are working together to figure out the best plan possible. So I think that we are definitely feeling more heard, and that again, this is progress and ensuring that those of us who are stakeholders and most impacted by these decisions are having an opportunity to share our perspectives and expertise. And we'll have more to share later this afternoon. Thank you.
For in-person learning, yesterday during his news conference, he was really pushing for it. Do you want to comment on his remarks at all?
I couldn't hear you.
The governor was really pushing, stood by in-person learning for some of the cities that are obviously not in Boston's in yellow, but some of the cities that are in white or green. He was really pushing for some version of in-person learning. He really stood by that.
Right. Well, I think what we've all said is everybody knows that in-person education is better. It's what our educators have been trained to do. We all want to go back in person. The question is when it's safe and where it's safe. And that's what we're working on with the district and the city, is to ensure safety first, because this is not the kind of situation where we can make mistakes because there are literally lives on the line. And so as much as we all want to be back in person, we've got to do it in a measured, thoughtful way that's centering health and safety and what we know about how to keep students and everybody safe.
good question. I'm glad you're allowing me to clear that up. So all of the survey is in multi-languages. We've translated it in 9 different languages. We also sent the email out in their preferred language. Some families have, in our system, it says that they prefer their communications to go out in English. And so what we're going to do now is call back up again on Monday, make sure that in our system it says what their preferred home language is, so that we can make sure that those materials are getting to them in their languages. But our materials are translated. They are available in 10 different languages, including English. And so we'll be following up with all of those families.
Thanks, everybody.